Hi there, and welcome to episode 7. When a patient complaint turns into a board investigation, what to do in the first 72 hours. So let's talk about it. So you get a letter, certified mail, your stomach drops before you even open it, and you already know what it is. You open it anyways because you have to. Notice of investigation. Suddenly, everything in your brain goes quiet and loud at the same time. You start replaying every patient encounter, every chart, every refill, every time you were busy and thought, I'll fix that later. You want to call the board and explain. You want to defend yourself. You want to text your staff. You want to scream. You want to cry, and you want it to disappear. But stop. Because what you do in the next 72 hours can either protect your license or hand them the case. So today we're talking about what exactly happens when a patient complaint turns into a board investigation and exactly what you need to do first. Not emotionally, strategically. Because we're not practicing scared. We're practicing prepared. So let's talk about how investigations actually start. So let me tell you something that may calm you down immediately. Most investigations do not start because you harm someone. They start because someone was upset. Most complaints come from disgruntled patients, former employees, competitors, pharmacies, insurance audits, and anonymous reports. Sometimes it's a custody battle. Sometimes it's a refund dispute. Sometimes it's someone who didn't get the prescription they wanted. And it doesn't have to be malpractice. It doesn't have to be criminal. And it does not have to be catastrophic. It can be incomplete documentation, missing consent, prescribing without documented rationale, delegation concerns, identity verification gaps, supervisory issues, or even scope misunderstandings. So here's the truth that most providers don't want to hear. You rarely lose your license because you're evil. You lose your license because your documentation doesn't defend you. And the board doesn't see your heart. They don't see what kind of person you are. They don't see how many patients that you helped. They see paper. And if the paper doesn't tell a story, then they fill in the blanks. So the first 72 hours, let's get tactical because these are critical. Not because you need to rush, but because you need to control yourself. Step 1, do not respond immediately. Do not call the investigator. Do not send an emotional email. Do not overnight records. Do not explain in a panic. And absolutely do not alter a single chart. And let me say that clearly. Do not alter a single chart. Even if you think, I just forgot to document that one thing, the timestamp trail exists. Audit trails exist. EMR logs exist. And if you change documentation after notification of an investigation, you've just shifted the case from documentation issue to credibility issue. Credibility is everything. So pause, breathe. This is not a house fire. This is paperwork. So step 2, pull everything and audit yourself. So before they see it, you need to see it. Pull the patient chart, intake forms, consents, prescribing logs, lab records, identity verification documentation, supervisory agreements, protocols, staff notes, lot numbers if applicable, communication logs, and even text messages if the clinical advice was given. You need to look at it as if you are the investigator and ask yourself, if I knew nothing about this patient, does this chart explain what I did and why I did it? Does it show assessment? Does it show clinical reasoning? Does it show informed consent? And does it show the discussion? Risks were talked about? Or does it show a prescription? Because a prescription without reasoning looks careless, even if it wasn't. You're not auditing to beat yourself up. You're auditing to prepare. So step 3, call your malpractice insurance. Most providers do not even realize they have licensed defense coverage. Call, ask specifically, do I have administrative defense coverage for board investigations? If you are employed, do not assume that your employer will protect you. Their priority is the business. Your priority is your license. And those are not always aligned. So if needed, consult a healthcare attorney. Not your friend's divorce lawyer, not your cousin's criminal attorney, a healthcare attorney, because this is your career, so you need to treat it that way. Step 4, lock down your systems. If one chart triggered the complaint, there are probably 10 more that look similar. So immediately audit your identity verification process, your consent forms, staff delegation practices, charting templates, follow-up documentation, controlled substance documentation if applicable, and protocol adherence. You don't wait for the board to tell you there's a pattern. You find the pattern first, and you fix it quietly, not frantically, but strategically. So let's talk about what gets providers in more trouble. It's the mistakes, because I've seen these destroy cases. So here's the first mistake: oversharing. You are not required to give your life story. Answer what is asked, clearly, professionally, and concise. The more you ramble, the more threads they can pull. Next one is throwing the staff under the bus. Saying like, I didn't know, or my MA did that, or my receptionist handled it. Boards care about supervision. If it happened under your license, it's your responsibility. Blaming staff makes you look negligent in oversight. Instead, demonstrate corrective action, because leadership always wins over defensiveness. Next mistake is blaming the patient. Never write, the patient was crazy, or they were drug seeking, or they were unstable. Even if they were difficult, you document behaviors objectively. Emotion never belongs in a response. Next, do not social media vent. Don't go online, don't vague post, do not educate about your situation, because investigators look, and opposing counsel looks, former employees look, and silence is power. So let's talk about the emotional side that no one talks about. The shame, the fear, the isolation, the 2 a.m. spiraling, the replaying of every decision you've ever made. You start questioning if you're cut out for this. You wonder if this ever ends. You feel exposed, vulnerable, alone. An investigation does not mean that you're incompetent. It means that you are practicing medicine in a litigious world. If you're practicing long enough, you will be complained about. Not because you failed, but because healthcare involves humans, and humans have emotions. This is a process, not a verdict. You do not let paperwork define your worth. So let's talk about how to be board-proof before it even happens. So let's shift into empowerment, because the goal is not survival. The goal is prevention. And here's how you practice board-proof medicine. Document clinical reasoning, not just prescriptions. Standardize consent forms. Create identity verification policies. Maintain staff training logs. Audit your charts quarterly. Have written protocols. Document risk discussions. And if you deviate from protocol, document why. Never cut corners because you're busy. Busy providers get investigated faster than bad providers, because busy providers skip details, and details protect you. So here's some final thoughts. Listen carefully. The goal is not to practice scared. The goal is to practice prepared. When you are prepared, an investigation becomes paperwork, not panic. You don't spiral, you strategize. You don't overshare, you respond. You don't collapse, you correct. Your license is your livelihood. Protect it like it feeds your family, because it does. If this episode helped you, share it with another provider who needs to hear it. And if you want tools, templates, and systems that protect you before the letter even arrives, you already know where to find them. Stay sharp, stay ethical, stay prepared, and never let fear make your decisions for you.